Hello viewers, in this video we are going to discuss about fissure in ano. So to start with, let's discuss about what all the structures we do have in a normal individual. So to start with, what the structure above you are seeing is referred to as rectum and the structure below is referred to as anal canal. So for a layman to understand, this rectum can be referred to as a dam and this anal canal can be referred to as dam gates. So what happens? So instead of water in the dam, there will be stool that will be getting deposited or accumulated in the rectum, and once the stool gets deposited to such extent that to large extent, it sends signals to the brain to empty it. So the brain sends signals again to the anal canal so that the gates can be opened. What exactly are the gates when it comes to anal canal is, these structures are referred to as sphincters. Just because we have these sphincters, we have a very good control over the stool, and not only stool, we do have a very good control over the flatus also. So these sphincters are responsible for it. In these sphincters also, we do have two types of sphincters. One is the external sphincter which is placed outside, and the other is the internal sphincter placed inside. These two sphincters work together and serve the common function, that is continence over stools and flatus. But the way these sphincters function is different. The external sphincter is completely under our control because it is a voluntary muscle. It's just like hand and foot. Whenever we want to fold it, we can fold. Whenever we want to relax it, we can relax. But internal sphincter, unlike the external sphincter, it's not under control. How internal sphincter works is, whenever we are during sleep or whenever we are unconscious, still there won't be any leakage of stool because the internal sphincter does its own job, and which is not under control. It's just like the heart muscle. It works on its own and it is not under our control. The only disadvantage or the character of this internal sphincter is, it is very oversensitive, just like a touch me not plant. The moment there is injury to the localized part, this internal sphincter contracts vigorously. So now let's move to what is fissure in ano. How a fissure in ano develops is, whenever person passes very hard stool, the anal canal stretches to some extent while passing stool, but if the stool is hard enough to such extent that this anal canal cannot dilate further, in such instances there will be a small tear or cut that happens in the region of the anal canal, which we commonly refer to as fissure in ano. So what happens if a fissure in ano happens, or what symptoms the patient can experience after having a fissure in ano? The first thing is severe amount of pain that is disproportionate to the amount of cut. Why this pain is happening? Generally, unlike if there is any cut in any other body parts of the body, what happens? We apply a dressing so that it doesn't get infected, and we will be giving enough rest to that part of the body. But what happens in fissure? Unlike in other parts of the body, we can't apply a dressing and we can't give enough rest at all, because every time the person passes stool, there will be some amount of friction on that cut area. Thereby, patient will be experiencing severe burning pain after passing stool, which may last up to 3 to 4 hours, and in some patients it may last the whole day also. Apart from this burning pain, patients may experience some amount of a thin blood streak in the stool, and apart from it, what people can experience is, they can feel that the motion passage has been bit tightened compared to earlier. Why this tightening is happening? Just as we discussed in previously, the internal sphincter is very sensitive. Whenever there is injury to that part which is in close proximity to the internal sphincter, this internal sphincter becomes oversensitive and it becomes tightened. So thereby patients can experience that, they can feel that tightening of the anal canal compared to the previous thing. So this adds to the damage in fissure in ano. How? Generally, if assume that if the anal canal is permitting 2 fingers easily, What happens in people with chronic fissure in ano means that fissure is lasting for longer duration just because the internal sphincter has become too oversensitive. The anal canal, which was earlier permitting 2 fingers, has tightened to such extent that it will be permitting only 1 finger now. So this adds to the damage, because even if the patient is not constipated, in these patients anal canal has got tightened, so even when they pass normal stool also, they will be experiencing disproportionate amount of pain because of the friction that is happening over the fissure area.